Join us now for Health for Life, brought to you by Hamilton Healthcare System. Today we're talking with Dr. Lisa Duhaime of Peeples Cancer Institute in Dalton. Thank you for joining us today, Dr. Duhaime.
I'm glad to be here, Bobby.
Dr. Duhaime is a board-certified medical oncologist at Peeples Cancer Institute at 1215 Memorial Drive on the campus of Hamilton Medical Center. She specializes in adult cancer and hematology disorders. She completed her internal medicine residency at Henry Ford Hospital in Detroit, Michigan, and her medical oncology hematology fellowship training at the H. Lee Moffitt Cancer Center at the University of South Florida in Tampa. Dr. Duhaime, of all the things you could have done in medicine, why did you choose to become a medical oncologist?
Well, Bobby, I actually thought I was going to be a dermatologist, but during my first year of residency, I had a rotation on a medical oncology floor, and God had different plans for me. By the end of it, I knew that dermatology was not my calling, medical oncology was.
Well, that is quite the story. And medical oncology, dermatology, two great things, but oncology was what you were meant to do.
Absolutely. I've never looked back.
Now, what's your favorite part of your job as an oncologist?
Hands down, just dealing with the people. The medical part of it's interesting, but it's dealing with the relationships of my patients. I go to work every day knowing that this is what I was put on this earth to do, and I love it.
I know doctors don't have much spare time. I know you work all the time. But when you have spare time, what's some of the things you enjoy doing?
I absolutely love hanging out at our farm with my husband and children, and I wake up at 4:30 a.m. every morning and go to CrossFit with my 3 teenage children.
Is that right?
It sure is.
Now, if you're up at 4:30, what time do you lay down at night?
8 p.m.
Every night?
Every night I go to bed at 8 p.m.
See, you and I are the same because I do a morning radio show, so I'm out of bed every morning by 4, and I'm in bed at 8 o'clock every night.
I tell my children anything that happens after 8 o'clock shouldn't be happening.
There you I love the sound of that. You say you've got a farm. Tell me about your farm. Do you have any cattle? What do you...
No, it's a 700-acre timber farm.
700
Yes.
acres, my goodness.
And we have a lot of trails, hunting, and my husband has an area cleared for horses, and he's in the process of building a wedding venue.
Is that right? That would be beautiful.
Yes.
Now, do you have any water, a pond, creek, things like that?
He's actually in the process of building a pond right now, and he's going to have a second pond where the horses are.
Oh, that's great. I hope he stocks it with some fish.
I don't know what his plans are. This man never stops. He's got more projects in the works than he has time to work on them.
A lot of men are that way. A lot of men that way. 700 acres. That's fantastic. We got a whole lot of ground to cover. A lot of things I want to talk with you about today. Don't go away.
If you're in need of medical care, don't delay. Your health won't wait. Hamilton Medical Center is ready to care for you. We are following CDC guidelines. Patients and guests are screened for COVID-19 symptoms. Those who are suspected to have the virus are treated in a separate area. Plus, Hamilton's high-powered UV light robots eliminate 99.9% of bacteria and viruses on surfaces. Please do not delay medical care. Your health won't wait. As always, Hamilton is here for you. Join us on a journey to better health. Health for life. Simply put, that is why Hamilton Medical Center is here. From primary care and specialty care practices near you, an accredited chest pain center, a certified joint replacement program, a new children's institute, cancer institute, endoscopy center, and more. Hamilton is here for you and your family. Learn more at hamiltonhealth.com. Hamilton Healthcare System. Health for life.
Welcome back to Health for Life. Dr. Duhaime, can you tell me about Peeples Cancer Institute?
Yes, it opened in January of this year on the campus of Hamilton Medical Center on Memorial Drive. Peeples Cancer Institute houses both diagnostic and treatment services in one convenient location. This allows for Hamilton's expert team of medical oncologists, radiation oncologists, surgeons, and clinical support staff to provide state-of-the-art care in a healing and nurturing environment. Peeples Cancer Institute is transforming cancer care in our region. Our multidisciplinary team provides medical oncology, radiation oncology, and hematology services and state-of-the-art cancer treatment. Hamilton Medical Center is ranked top 10% in the nation in patient safety for cancer care. Peeples Cancer Institute is accredited by the Commission on Cancer Care.
Top 10% in the nation?
Yes, it is.
That is fabulous. Very specialized, very important, and in the top 10% in the United States. Now, that is a beautiful facility that you have there.
It's absolutely gorgeous.
They have done so much. They built that. I think you opened in January. Is that right?
Correct.
Opened in January. And it is just a beautiful facility. And all the tools, all the equipment, and all the education is right in Dalton, Georgia. I know there's board-certified medical oncology at your place, correct?
Correct. So there's 3 oncologists we have, Dr. Turner, Dr. Zhang, and myself. We're there Monday through Friday, full-time, 8 o'clock through 5 o'clock.
Okay.
We have radiation oncology and surgeons. We have cutting-edge radiation therapies, including the Varian TrueBeam linear accelerator and 4D CT scanners, a simulator and high-definition radiation brachytherapy, genetic testing and counseling to help guide decision-making, 3D mammography and ultrasound imaging, private and semi-private infusion rooms, multidisciplinary care, patient navigators, and oncology social work services are available, which is priceless. Working for Hamilton has really been a blessing for me because having the social worker present at the cancer center full-time has helped the patients and the physicians focus on taking care of the cancer.
We're going to take a short break. We'll be right back.
Join us on a journey to better health. Health for life. Simply put, that is why Hamilton Medical Center is here. From primary care and specialty care practices near you, an accredited chest pain center, a certified joint replacement program, a new children's institute, cancer institute, endoscopy center, and more. Hamilton is here for you and your family. Learn more at hamiltonhealth.com. Hamilton Healthcare System. Health for life. If you're in need of medical care, don't delay. Your health won't wait. Hamilton Medical Center is ready to care for you. We are following CDC guidelines. Patients and guests are screened for COVID-19 symptoms. Those who are suspected to have the virus are treated in a separate area. Plus, Hamilton's high-powered UV light robots eliminate 99.9% of bacteria and viruses on surfaces. Please do not delay medical care. Your health won't wait. As always, Hamilton is here for you.
Welcome back to Health for Life. Today, talking with Dr. Lisa Duhaime. Let's talk from Peeples Cancer Institute at Hamilton Medical Center. Let's talk about lung cancer. How does lung cancer occur?
Lung cancer occurs when abnormal cells in the lungs divide and multiply haphazardly, eventually forming a tumor. The cancerous cells that make up the tumor can invade and destroy nearby healthy lung tissue. These cells can also break away from the tumor, travel to other parts of the body, and establish new tumors. There are 2 main types of lung cancer, small cell and non-small cell. The 3 main types of non-small cell lung cancer are squamous cell carcinoma, adenocarcinoma, and large cell carcinoma. Non-small cell lung cancer accounts for about 85 to 90% of lung cancers. It usually grows and spreads less quickly than small cell lung cancer.
I understand. You don't have to smoke to get lung cancer, correct?
Those are very rare. The vast majority are associated with smoking.
So what causes lung cancer other than smoking?
Environmental, but sometimes we just don't know. And when that happens, it usually tends to be someone who's very young or someone who is very old. And age is a major risk factor for any cancer.
I understand that you've got lasers that can just pinpoint that tumor, correct?
Correct.
And
the radiation beams are becoming more and more specific, and now we do things called stereotactic radiation, where instead of, in the past, patients have needed 10 or 15 radiation treatments. Now they can get away with 1 or 3 doses of radiation for the same type of treatment, so patients have less side effects.
Now, are you still seeing a lot of asbestos related lung cancer? I know they've tried to get asbestos out. I mean, from when I was a kid, I can remember they were trying to get asbestos out of public schools and buildings and things like that. But I still keep hearing about asbestos.
Well, it's interesting. I saw it much more when I was practicing in Ohio. I see it more in older people. I do not see it in young people.
You see it? You don't see it in young people.
I have not seen it in a young person. I have not seen it in anyone under 65.
Is that right? So mostly it's older Americans or older adults that have asbestos-related cancers.
Correct.
I understand.
Now, about the time that I say I have never seen something is when I see it.
And there's always exceptions.
I tell people cancer doesn't read our textbooks, so I never say never.
How can we reduce our risk of getting lung cancer?
Don't smoke. I can't stress that enough. And if you do smoke, stop. There is plenty of data to show that after 15 years of stopping smoking, your risk drastically decreases. So if you stop now, you can drastically decrease your risk of smoking. Your risk of getting lung cancer starts to decrease almost immediately when you stop smoking.
Regardless of how long you've smoked.
How long you've smoked, absolutely.
Just
regardless.
stop smoking.
Stop smoking.
Got you. We're going to take a quick break. When we come back, we're going to talk about how lung cancer is detected. We'll be right back on Health for Life.
Join us on a journey to better health. Health for life. Simply put, that is why Hamilton Medical Center is here. From primary care and specialty care practices near you, an accredited chest pain center, a certified joint replacement program, a new children's institute, cancer institute, endoscopy center, and more. Hamilton is here for you and your family. Learn more at hamiltonhealth.com. Hamilton Healthcare System. Health for life. If you're in need of medical care, don't delay. Your health won't wait. Hamilton Medical Center is ready to care for you. We are following CDC guidelines. Patients and guests are screened for COVID-19 symptoms. Those who are suspected to have the virus are treated in a separate area. Plus, Hamilton's high-powered UV light robots eliminate 99.9% of bacteria and viruses on surfaces. Please do not delay medical care. Your health won't wait. As always, Hamilton is here for you.
Welcome back to Health for Life. Dr. Duhaime, I do have a question for you. How does a person know when they have lung cancer?
Unfortunately, lung cancer often does not cause symptoms until it has spread. Symptoms may include a persistent cough, constant chest pain, shortness of breath, wheezing, coughing up blood, hoarseness, swelling of the neck and face, repeated bouts of bronchitis or pneumonia, loss of appetite, weight loss, or fatigue. Make sure you see your doctor if you have any of these problems. They may not necessarily signal lung cancer, but may be caused by another condition.
So regardless, you need to see a doctor if you have any of those.
Absolutely. Absolutely. Early detection saves lives. If you are a smoker or former smoker, ask your primary care doc if you qualify for low-dose lung cancer screening at Hamilton Diagnostic Center. It's a painless 10-minute CT scan that can save your life. Screenings are available for anyone who's age 55 to 77 years old, has been an active smoker or quit in the last 15 years, and has had a 30-pack year history of smoking. You receive a written order from your doctor, nurse practitioner, or physician assistant. Medicare or most commercial insurance companies now cover the cost of the low-dose CT scan for lung cancer screening. Hamilton Diagnostic Center is our region's only accredited lung cancer screening center.
Well, how is lung cancer treated?
If lung cancer is found, normal treatment could include anything from surgery to chemotherapy, radiation therapy, targeted therapy, including laser therapy, or even immunotherapy.
Can you tell us more about how chemotherapy is used to treat lung cancer?
Sometimes we give chemotherapy before radiation or surgery. Sometimes we give it with radiation, and sometimes it's after radiation or surgery. Often it helps to shrink the tumor and make it easier to remove with surgery, and sometimes we use it to improve quality of life.
Very good. What about targeted therapy? I heard you mention targeted therapy. What exactly is targeted therapy?
If someone has just a tumor in the lung and there's no signs of lymph nodes that are involved and no signs of cancer anywhere else in their body, sometimes you can give just radiation, and sometimes it's just 1 or 2 doses or 5 doses of radiation just to that tumor, and that's all they need. It's called SBRT, which is localized radiation just to that tumor.
Now, you've got machines, I understand, computers that can just pinpoint that and go right to that tumor.
Correct.
State of the art.
State of the art.
You mentioned immunotherapy. What is immunotherapy?
So immunotherapy has recently emerged as a new treatment option for certain lung cancers. While any cancer treatment can cause side effects, immunotherapy is generally much well tolerated, and it is actually a treatment that is given to stimulate your own immune system to attack the cancer. And it doesn't affect the white blood cells and the red blood cells and the platelets. Older chemotherapy tends to just kill off all actively dividing cells in the body.
Right.
And immunotherapy doesn't act that way. So because of the way immunotherapy works, older patients, even in their 80s, and some patients even in their 90s, can tolerate it.
Well, just the name immunotherapy would make me think it has to do with your immune system.
Correct.
And it kind of jumpstarts that and makes your body fight the cancer when it wasn't before?
Exactly. Treatment of cancer has so changed in the past 10 to 15 years. So the targeted therapy that I told you about earlier was radiation-based. We also have targeted therapies in the medical oncology side of things. We have found specific targets that drive cancer growth that we can now make drugs that specifically affect those targets, and therefore they don't cause all the side effects in the rest of the body, and they're only affecting that target in those cancer cells. And they can still cause some side effects, but to a much lower degree. And so, once again, older patients can tolerate them, and it allows us more options for patients and better options that patients are more likely to respond to. Now, with targeted treatment, we know that when we give this drug, this patient that we're giving this drug to, we know has this target that we're giving this drug to, so they have a much higher likelihood that they're going to respond to the treatment.
Well, that is wonderful news, and this has just been the last 10 or 15 years. Can you imagine what it's going to be like in 25 years from now?
It's amazing.
Well, you're a young lady. You'll be around and practicing in 25 years.
Around.
And can you imagine what that's going to be like 25 years from today?
You know, I've watched certain cancers that we thought would never get cured. Now we are seeing patients that I can't say they are curable yet, but I'm seeing patients that their survival used to be 6 or 9 months. Now patients are alive 5 years, and I'm still treating them. And so I have more and more miracle cases that I can tell other patients about. And I've always told patients that the 3 most important things they need to cling to when they have cancer is faith, hope, and love. And they have more and more hope than they've ever had before.
Faith, hope, and love.
That's right.
That's very nice. For more information or an appointment at Peeples Cancer Institute, call this number, 844-PCI-HOPE, 844-PCI-HOPE. To make an appointment for a low-dose CT, call 706-272-6565. Visit hamiltonhealth.com/cancer.
If you're in need of medical care, don't delay. Your health won't wait. Hamilton Medical Center is ready to care for you. We are following CDC guidelines. Patients and guests are screened for COVID-19 symptoms. Those who are suspected to have the virus are treated in a separate area. Plus, Hamilton's high-powered UV light robots eliminate 99.9% of bacteria and viruses on surfaces. Please do not delay medical care. Your health won't wait. As always, Hamilton is here for you. Join us on a journey to better health. health for life. Simply put, that is why Hamilton Medical Center is here. From primary care and specialty care practices near you, an accredited chest pain center, a certified joint replacement program, a new children's institute, cancer institute, endoscopy center, and more. Hamilton is here for you and your family. Learn more at hamiltonhealth.com. Hamilton Healthcare System, health for life.
Thank you for listening to Health for Life, a presentation of Hamilton Healthcare System.